Hey everyone, Dr. Lloyd Stegemann from the Better Way Center in Corpus Christi, Texas. If you struggle with your weight, you may have had a conversation with yourself about, well, should I do medical weight loss or should I do surgical weight loss? Well, I'm going to help you decide which one you should do. When you've struggled with your weight for a long time, you generally want to lose weight. Here's what I will tell my patients. I don't care how you lose weight, as long as you do it in a good, healthy, safe way. The biggest difference between medical and surgical weight loss is the amount of weight that someone will typically lose and how long they'll typically keep it off. And so there's several different ways to lose weight. We used to think that it was more like a pyramid, like you had to do diet exercise, and if you don't do well with that, well, now we can add medications in. And if you don't do well with that, then now we can do surgery on you. We really don't think about it that way anymore. We think it more of a linear. So if someone comes to my office and they have 100 pounds to lose, I can say, okay, well, here's some different options that we have. Well, if you try it on your own, just go out and reduce calories, go on a good keto plan. The likelihood that you're gonna lose about 10% of your weight and keep it off for 1 year is about 1 to 2% in most studies. Really not great. If you wanted to do more like a Jenny Craig or a Weight Watcher, something a little bit more formal that's gonna, I have some responsibility of going in, there's a plan that's there for me, those numbers go up a little bit of losing 10% of your weight and keeping it off for a year. Still a little less than 5% of people are able to do that and keep it off for a year. Then as we move along, now we would do more of a medical weight loss. In medical weight loss, we work on dietary and behavioral and exercise, but we add some medications in to help combat the body trying to stop the weight loss. And so we can control hunger a little bit better, and we can work on some different hormone pathways that allow people to lose more. And especially with some of the newer medications, we can see people lose 20, 30% of their body weight, which is really approaching surgical numbers if they respond to the medication. And so those numbers, somebody wanting to lose at least 10% of their weight, go up significantly. Upwards of 30 to 40% of people will be able to lose 10% of their body weight and keep it off for more than a year. Well, then we move more into the surgical realm. And so for the surgical realm, typically we're going to see patients lose somewhere between 30 and 40% of their body weight with surgery. And depending on the procedure that somebody chooses, we can see 7, 10, and now we even have 20-year data on how long people keep weight off. So when somebody comes in, it's really a choice of things that they can do. The key is that they lose weight, and 10% really is the magic number, because if we can get people to lose 10% of their weight, we start to see improvement in health, in diabetes, in blood pressure, heart disease. All of the problems that we see with weight start to get better with 10% weight loss. Now, again, if somebody has 100 pounds to lose, they may not be happy with 10%. They don't want to lose 10 pounds. They want to lose 70 or 80 pounds. Well, for those types of numbers, now we're looking more towards the surgical side being the most likely way. The only way? No, but the most likely way. And so these conversations you would have if you go to visit somebody who specializes in weight loss, whether that's medical or surgical. They can talk with you about the likelihood of achieving the weight loss that you want with the different methods that are available. Thanks for tuning in. If you enjoyed it, subscribe to the channel, come back and see us. Lots of great information. Have a great day.